Mental Health Talk with Evelyn. So you're welcome to today's edition. I'm happy to have you watch today. So today we are going to be talking on a very important topic, and it's on postpartum psychosis or depression, whichever one you call it. But before I start, okay, so you know already, this is Mental Health Talk with Evelyn. So this program is every Wednesday by 3 p.m. and it's brought to you by Grace Hill Behavioral Health Services, and of course supported by Grace Hill Healthy Mind Initiative. So the Grace Hill Behavioral Health Services, that the Grace Hill Place Hospital, we're a mental health and drug rehab facility located here in Lagos. So what we do mainly is psychiatric management and drug rehabilitation. Okay, so we go into the topic for today. So we are talking about postpartum psychosis in men. So you'll be wondering why men. Of course, yes, it is very common for women to have postpartum psychosis or postpartum depression rather. It is very common, but it's quite rare. But men also experience postpartum psychosis as well. So why people or too much focus or attention has been directed towards women? Of course, yes, women are always at the receiving end. I don't argue about that. But also, men also experience such. And because people, we often give too many attention to women, we fail to acknowledge the fact that even the man who is going to be the father of the child too also needs attention and every other care you give to the woman. So we'll be talking about it today. I'll be talking about the risk factors, the symptoms, and how you can identify that your spouse, your partner is actually going through postpartum psychosis or depression. Okay, so first of all, let's establish that postpartum psychosis is a rare illness, especially when it comes to men. So it's actually not rare because men also experience it. But the thing is, they usually do not speak up. They usually feel it's a normal thing, and of course, it's normal for them to feel that way. It's normal for them to feel some kind of way and all that. So it's actually not rare. Studies have shown that men are actually suffering from postpartum psychosis these days, especially with the way the economy is. If too many factors actually contribute to that. Okay, so now let's know the difference between postpartum psychosis and baby blues. Okay, now I'm talking about women, though our focus today is not on the women but the men. But I just want to establish some kind of ground so we understand better. Now, baby blues is usually very different from postpartum depression. So when a woman experiences mild changes after giving birth, it's actually known as baby blues. So, but postpartum depression, it's when that feeling has lasted for a very long period of time. It's now going into weeks or some weeks or months. That's when you can now say the woman is actually having postpartum depression. So it is also important to know that while women turn their own to sadness and inward fear. So when a woman has postpartum depression, they kind of feel down, they are always sad, they have this fear in them. Men are likely, going to express their own depression through anger and aggressiveness. So they begin to get angry, they begin to get aggressive, they begin to get irritated, and also they begin to get anxious, and this anxiety thing also happens as well. So let's move on. So let me quickly talk about the risk factors for postpartum depression in men. So what are those risk factors? What I mean by risk factor is, what are those factors that can actually cause postpartum depression in men? One of these is a history of the disease. So if the man actually has some kind of history of postpartum depression down the family line and all that, there is also a possibility that the present father is also going to have it. And it is usually common with new fathers. So even as new mothers too also experience postpartum depression, new fathers too also experience postpartum depression, because they have this feeling of what's going to happen, I'm expecting a new child, what's next and all that. So I'm going to talk about the symptoms as time goes on. Then relationship instability. So once that relationship is not stable, they tend to have, there's a possibility of postpartum depression. Once the relationship is not stable, then financial problem or stress. Yes, we all know that the birth of a baby comes with a lot of responsibilities. Now, the responsibility is not only on the woman to make sure that the child is okay and well taken care of, and the pregnancy is very healthy, but the responsibility now falls on the man. So because of the financial problem, especially when the finances are not there, so it comes with financial problem or stress. So when there is not enough finance to cater for the child, there is possibility of postpartum depression in the man. Then of course, when a baby is sick, when the child is sick or premature, yes, when the child is sick or premature, so there is also possibility of postpartum depression in men. Then of course, men who have experienced loss of a loved one, either in adult years or when they were becoming a parent. So if a man actually experiences some kind of trauma growing up, or maybe he sees a loved one going through various trauma and experiences and bad experiences actually. So there's usually this fear in that man, what will become of me if I eventually become a parent? So it is part of those things that can cause postpartum depression in men. So let's quickly go into the symptoms because of time, which is the major reason we are having this conversation, such that if you have anyone that is actually experiencing this, you can, assist the person in one way or the other to get professional help. So some men actually portray negative attitude the moment their baby is born. Now, it's not because they are not happy or they don't like the fact that they have a child to take care of. No, it's not because they are not happy that their own child is coming to the world. No, there are actually several reasons that actually caused it, which I've explained before now. So one of the symptoms of postpartum depression in men. So please note that this can be as a result of fear of losing their wife's attention, which definitely will be more directed at the child. So when a woman gives birth, of course, a woman also faces some kind of depression and all that. Then also the man too has a possibility of having this fear that the attention the wife usually gives them or the partner gives them will now be more directed towards the child. So some common symptoms are increase in anger and conflict with others. So you see that new fathers begin to get angry. They begin to, just give me a moment. Okay. So they begin to get angry, increase in anger and conflict with others for no reason. They just flare up and get angry for no reason. Then increase in use of alcohol and prescription drugs. So when a new father starts using alcohol and prescription drugs, it is possible that the man is actually going through a lot. He's actually going through some form of depression or one thing or the other. So it is best to know what the issue is, especially when that behavior that's not the kind of behavior they exhibit before that particular child is born. So you might want to know what actually the problem is by getting a professional. Then frustration or irritability at the sight of the child. So during that NSAS period, we got so many calls. Personally, I got so many calls from people, from mothers, coupled with the fact that everything was going in some kind of direction. Some mothers actually experience postpartum depression. So one of the symptoms is, you get irritated at the sight of the child. You wouldn't even want to see the child. So any little thing, you just flare up. So if the child is coming to you for, love and attention and all that, you start getting irritated. So this is one of the symptoms of postpartum depression in men, most especially. So when they see the child, they will be like, they just get irritated for no reason at the sight of the child. Then violent behavior towards the child. They tend to be violent towards the child, and that is because they are depressed. Of course, I agree with the fact that men usually have responsibilities to cater for. They have responsibilities they have the responsibility to provide for the child. They have the responsibility to take care of the child, to provide fatherly love, fatherly support, and whatever support the child needs to grow and nurture well. So they tend to behave, violently towards the child. So it is one of the symptoms of postpartum depression in men. Then feeling discouraged. They are always discouraged. So one thing or the other, they get discouraged, at anything they want to do. Then, of course, very important, constant attempt to harm the child. So if you have a partner, or if you have, of course, yes, a partner that is a new father, whether a new father or not, one of the major symptoms of postpartum depression, they want to harm the child. Constant attempt to harm the child. So even when the child does nothing wrong, they would want to harm the child. Even when the child does something right, they just see faults in everything the child does, whether good or bad. So it's one of the symptoms. Then another one is feeling of jealousy and insecurity. Of course, when the child is giving birth to, much love and attention from the mother is now being directed to the child. And that is one mistake some, women make. I understand that it could be very stressful. You have to take care of your child. You have to do so many things to make sure that the child is well and all that, attention and everything, because the child is tender. But it is also very important as a new mom to also focus on the father as well, and whoever that is taking care of the child. So if the father of the child is around, they also need love and care. So sometimes when I see on social media a man is announcing the birth of the wife, and the man will be like, mother, child and father, they are doing fine. Yes, the person is actually not wrong, because they also need attention. So they have this feeling of jealousy and insecurity. Of course, who wouldn't feel jealous when the love they get from a particular person, then all of a sudden that attention and love is being directed to just one child. So it is better to balance that love, that feeling and that care, so they won't fall into postpartum depression. Then increase in complaints about physical problems like headache, digestion problem, in order to get attention. So you see some men, though I would agree that some people they are actually very intentional about it, but you see they start complaining about pain, something that is not there. So when they are not feeling anything, they are not hearing any voices, or they are not seeing anything, they start complaining. They're having headache, they're having indigestion, pain here, pain here, pain here. They just do that just to get attention from the wife. They just do that to get love and attention from other people around them as well, because they also need love and care. So conflict between how you feel as a man and how you are. So you are not sure of yourself. You are not sure of that feeling. Okay, some people actually, so when they are expecting their child, there's usually this feeling of happiness, especially those that usually have some kind of financial challenge or the other, because you now have some sort of responsibility to take care of. So there is usually this mixed feeling around them. For those men that actually suffer postpartum psychosis, there's usually this mixed feeling. Of course, yes, they are happy that their child is born. They are happy that they are doing well in terms of reproduction and all that. But at the same time, they are not happy. They are sad. There's usually this mixed feeling. So it's actually a symptom of postpartum depression, and it's a symptom when it is it is usually for over a period of time. It's happening for over a long period of time, maybe within weeks, months and all that. Then you should seek professional help. Then lastly, okay, not lastly, I still have some more points. Then thought of suicide or death. For me, that's the height of it. You should seek professional help immediately. So if as a new father or as a young father that is just experiencing fatherhood or motherhood, whichever one it is. So but my main focus today is on the men. So if as a young father you're having this thought of suicide for no reason, or probably because you feel the responsibility is too much on you, or you feel you no longer get that love and attention from your wife, your spouse, or whoever that is around you, and you are having the thought of suicide, I think you should seek professional help immediately. You should seek professional help immediately. Then one other symptom of postpartum depression, so I've mentioned it before, so they begin to engage in some sort of risky behaviors like abusing alcohol, drugs, gambling, of course extramarital affairs and all that. So they engage in some behaviors that they usually do not engage in before the child is born. I am not disputing the fact that there are some things that could have led to that, not necessarily because the child is born, but part of the symptom is that they engage in risky behavior like abusing alcohol because they feel down. Of course, they jump into abusing alcohol. So before we conclude that your partner has postpartum depression, so after listening to all these symptoms and risk factor, so you cannot just conclude all of a sudden that your partner is suffering from postpartum depression or postpartum psychosis. So there are some questions that you might need to ask, or you might want to know. So as a person become irritable all of a sudden, so is the person becoming so irritable or agitated? So at the sight of the child, does the person get irritated easily? Probably that's one of the questions you might want to ask before concluding that your partner is suffering from postpartum depression. Then is he distancing himself from the partner or baby? So I know of some cases where the man would distance himself from the partner and the baby, probably because the partner has given too much or is giving too much attention to the baby, such that they don't even know when their partner starts distancing themselves from them and their baby. So it is probably one of the questions you might want to ask before concluding that your partner or whoever it is around you has or is suffering from postpartum depression. So another question you might want to ask is he gambling? Is he drinking? Does he take drugs? Or is he living a reckless life or reckless behavior? And probably this is not what he does before now or before the birth of the child. You might want to know as well. It is very important you know before you conclude. Then does he have a personal history or family history of depression? So it's actually one of the questions you need to know, because one of the causes of mental illness, which I will talk about some other time, is that mental illness is hereditary. So some people actually inherit is hereditary, so it's in the gene. So I've actually seen a family that, all three of them in the family has mental illness. So you might want to know if this person has history of family depression or personal depression. So you might want to know, so as to know how to help or how to come into that situation. Then another question you would want to ask yourself before concluding that your partner has postpartum depression is that, is he sad? Is he very sad all the time? Is he often sad? So is he uninterested in doing things he usually enjoy doing? So if all of a sudden he stops doing the things he enjoys doing more, maybe he stops watching the TV, or he stops seeing news or listening to news at 9 o'clock in the evening. So probably because he doesn't want to hear the cry of the child, or he doesn't want to see the child or something, then he goes out. Or probably he starts, leaving your bedroom, your bedroom that you usually share with him. So if he starts, doing some kind of, if he starts portraying some of those behaviors, you might want to know what the reason is. So it's one of the questions you need to ask before concluding that your partner has postpartum depression. And of course, you have to also seek professional help. It is very, very important you seek professional help. Then again, so does it make comments that he feels worthless or shares suicidal thoughts? Personally, I take this suicide of a thing very serious. So when I see a post, or when I see someone, making some kind of comment, some kind of post about suicide, having suicidal thoughts, I take interest in that person all of a sudden, because I would want to know, why is this person acting like this? Why is this person thinking this way? Hope this person is not actually on the path to committing suicide. It is very, very important we find out about those things. Then does he spend more time usually at work than at home? I agree that sometimes the work becomes very serious and you need to spend more time. But is this something that it's now a constant behavior? So you might want to know about this thing. You might want to ask about these questions that I've listed out for you to be able to conclude. Like I said, it is very, very important to seek professional help. So this issue of postpartum depression is not, the topic is actually a very broad topic, but because of our time, that was why I pointed out these factors to help us and guide us so as to detect and know when our partner is actually suffering from postpartum psychosis or depression. Of course, yes, there is help for paternal postpartum depression. So there is help. So if a man is actually suffering from postpartum depression, it is very important you seek help. So even though I understand that some men may laugh at the idea, of course, I'm not a woman now. I'm not the one that gave birth. I'm not, all those kind of thoughts and all that. I agree that some men may laugh at the idea, but the truth is, it is the real deal. It is the real deal. And they will never agree that it is affecting them, but that is the truth. So there is nothing shameful about having postpartum depression as a man. So if you are having postpartum depression as a man, or you are being depressed as a man as a result of your wife or your partner giving birth to a new child, or you are a new father, there is actually nothing to be ashamed about. So you have to seek professional help. I understand that fatherhood is a very huge, is a huge journey, and of course it's a job. It's a full-time job, just like they say motherhood is a full-time job as well. But then if you are having some of these feelings, if you are having the feeling of killing your child or harming your child, or just seeing the child and wanting to throw away the child for no reason, please seek professional help. It is very, very important you seek professional help. So it is also very important to maintain a positive mood when you are a new father, or when you are thinking about being a new father. It is very, very important. So thank you so much for joining in. If you have any question, you can drop it in the comments. I will definitely reply them. If not now, if I see your question or your comment, I'm going to reply them. So thank you so much. So someone commented here and she said men are not left out in the postpartum thing. Yeah, very true. So even both the men and the women, they also suffers it. So it's not only the women that suffers postpartum psychosis or depression. Like I said, the men also suffers postpartum psychosis and depression. So I hope these tips they are helpful, and you'll be able to flag it out if you notice that your partner is suffering from postpartum depression. Please speak out, okay? Please speak out. I believe there are professionals, there are mental health professionals that are ready to help you through that journey. So thank you for joining in today. Thank you for joining. I'm seeing some familiar faces that joined. Thank you so much. Until I come your way next week, my name is Evelyn, and this program is called Mental Health Talk with Evelyn. So it's you want to know more about mental health. It's a mental health education program where I talk about different mental health issues or different trending issues affecting your mental health as an individual. Thank you for joining in. Till I come your way next week, it's bye-bye.